Welcome. Thank you everyone for coming to this month's Breakfast at SSCY. So this morning we are pleased to welcome Jennifer Dunsford, who is the Regional Director of WRHA Ethics Services. And so she'll be talking to us about ethical decision making, and hopefully there'll be time for questions and discussions about anything that you in particular have about maybe the ethical decision or issue that you've been struggling with, or just wanting for clarification, or just a general thought question that the group can discuss. So for the people who are joining us on the webinar, which is quite a few actually across Canada for this one, so we're high profile. So if you have any questions on the webinar, just type them into the chat box and then I can read them out to Jennifer and she can answer them for you. Okay, so thank you very much for coming, Jennifer.
Hi, thank you for having me. My plan for this is actually a fairly short presentation, so I'm hoping that we can do the back and forth during the presentation. So if you have questions or comments or thoughts, stop and we'll chat about it. I've tried to kind of tailor it to your area of practice, so you can let me know if I hit the button or not. And if not, maybe we can kind of switch some of the, I'll use case studies to sort of example, or as examples of how some of the things that we use, some of the processes and methods and tools we use to make ethical decisions, some of the factors that make a difference between right and wrong in a particular situation. So if I've come up with a case example that doesn't quite work for you, we can tweak it so that it works, so that you can kind of see where I'm coming from, and we'll just kind of go from there. There we go. Now, I think about ethics as a roadmap or a system or a process for getting from point A to point B. And point A is you have a problem or a question or a dilemma or a difficult situation, and point B is the solution to that. So there are different ways that you can get there. There are different factors that will make a difference between right and wrong in a particular situation, but ethics is not an algorithm that's going to give you a definitive result. It's not going to give you the same answer every time. You can have two different families, two different situations that look pretty similar, but when there's something materially different between the two, you'll have a different answer for one than the other. And that's the nature of ethics. That's the nature of the work that we do. And so I think about ethics as a system or a process for working through those factors that make a difference between right and wrong, and getting us to a point where we can move forward with a resolution to a situation or a dilemma. An ethical dilemma is a situation where we have a choice. We have a choice that we need to make. So often there's not the luxury of time to kind of consult and weigh and balance and let's see how things play out. So you often need to make a decision in a fairly short amount of time. And there's always going to be disagreement about what's important. So the values of the people or the parties involved. So maybe it's the values of the child, the client, the family, the healthcare team, different members of the healthcare team. So the nurses, the physicians, the physios, the OTs, they might have some disagreement on what's important in this situation. What's important, and I'll talk about values in a minute in a bit more detail, but what's important is the values of the people in the situation. And ethics is always about a conflict between values. So we can have a tough decision to make, or a tough situation, when what our family wants is different from what the team thinks is the right thing to do. And so there's some space in the middle there where we have a decision to make. Do we kind of prioritize the values of the family, or do we prioritize the values of the team, and how do we move forward?
It's not really showing up on the webinar.
Oh.
Can we try to modify it? See, it's only showing, sorry. Technical difficulty.
Okay, hang on.
It's only showing your front side like it's frozen on it.
Okay. You know what? Let's turn it off, close it, and turn it back on again, because it might have to do with me messing around with things.
Okay, sorry. Okay, so click show your screen.
Okay. What are they seeing?
And just wait.
Oops.
Maybe click show me just the regular screen one.
There we go. All right.
Okay.
Sorry about that. Okay, so difficult choices, differences in opinion on what's important in a situation. These are situations where we always have more than one option, and sometimes they don't feel like, or often they don't feel like good options. So bad choices that we have to make, or choices between undesirable things. And no matter what we pick, we're going to have to make a trade-off. So we either trade sort of freedom and autonomy for safety, or we prioritize safety and do things that will prevent, say, a fall or a choking episode, and do that at the expense of the individual's choice or their ability to choose what they want to eat or how they want to move around the world, that kind of thing. So we're always making a trade-off, and neither of them feels very good. These are really hard when, in order to choose one thing, another thing becomes impossible. So if your choice is, do we start a feeding tube for this person, it's kind of hard to undo that after the fact. It feels like a much more momentous decision to remove an intervention that we've started once we've started it, if it turns out that at some point down the road that isn't the right thing to do anymore. And they're hard because you can't do both things at the same time. You can't have a feeding tube and not have a feeding tube. So you do need to make some kind of a choice. So we have all kinds of things, and they can be varying degrees of consequence. So these can be sort of fairly trivial things right up to life and death decisions that need to be made in a fairly short period of time. And ultimately what you want is to be able to sleep at night knowing that we thought about everything we needed to think about. It's a rotten situation, but we've made the best decision we could because we thought about all of the factors that would make a difference between right and wrong. So you want a solution that you can live with, even if it's not ideal. And often these are very emotional, very personal decisions, and they're about our values, or they're about what sort of is at the core of our integrity and our identity. And so these are things that you feel really strongly about. And so no matter what you pick, it can feel pretty awful. And I'll touch on that again as well towards the end. So I have a couple of thoughts on the kinds of situations that you might run into, and I kind of ran these by Jesse and some others here, so you can let me know if this seems like stuff that you've been worried about, or if you have other things. But things like what happens when a family brings you a sheaf of papers that they printed off from Dr. Google and says, can we try this? Can we do this? And you know that it's not evidence-based. You know that it's probably not going to make much of a difference, if any, and it might even be harmful. How do you balance what the family wants, which is really what they want is what's best for their child, and there's a difference of opinion on what that best is. So how do we incorporate that kind of thing into the care plan that we're providing, so that we demonstrate respect without compromising our ability to provide evidence-based care. How we go about establishing and maintaining therapeutic relationships. So you have to do some sort of opening up, relationship building when you first enter into a care plan with a family, and there's a line that you don't want to go beyond. You're not, as a healthcare professional, you're not going to become friends with people, although sometimes it feels like that when you're in close proximity and doing some really important and intimate things with them and with their child. But at the same time, and it's important to have a good relationship in order to establish trust and that kind of thing. At the same time, you don't want to cross that line, so that can be challenging. And then things like whether or when to call in CFS. We do have some guidelines, some laws that say these are situations that we must report. But anytime there's some discretion in the choice that you're making, like maybe not if we're going to report, but when. You know, if we can wait for a couple of hours until Auntie can come, and it won't be quite so upsetting or devastating for this family if there's somebody familiar there. Anytime there's some discretion, there's probably some ethics involved. And so we have to think about how we decide exactly what we're going to do and when. So some of these are the things that kind of occurred to me. Do these sound familiar? Are there other things that come to mind that keep you awake at night that you're worried about or that you've been struggling with?
I always struggle with when is it time to end a therapeutic relationship based on multiple factors.
Yeah, and there's going to be all kinds of things that make a difference. Oh, sorry, repeating the comment was when to end a therapeutic relationship based on all kinds of different things. So things like, do we have any more interventions that we can offer? Maybe this is an end of life situation, and so how do we make that transition to a palliative care kind of program? All kinds of different things would make a difference between staying on the program and closing a file, and that can be a real struggle for not only for the families that you've established a relationship with, but for the staff who maybe feel like they still have more to offer or they don't have more to offer and it really sucks. Yes?
Kind of related to that is balancing the needs of the kids currently on caseloads versus the ones on the waiting list, and the kids that are waiting and these ones have services and they want to continue, or they could benefit from more, but they don't meet the current criteria, and kind of that balance between waitlist and currently served.
Yeah, that's a good one. The balance between waitlist, kids that are on the waitlist are waiting for different kinds of services, and the kids that are already on your caseload. And so it's sort of related to that previous question where you might be reaching the end of your your care plan or your roadmap for one kid, knowing that there are others coming along behind them and that could benefit from the services that you have. Another thing that causes a lot of moral distress for clinicians all over the system is we have a person who needs services and we just don't have any room to put them on. This happens in addictions all the time, actually. You've got somebody who comes and says, I'm ready for treatment, I'm ready to deal with this, but there's just nowhere that you can send them. And sometimes your window is pretty small. And if you miss the window for a lot of different kinds of interventions that we have in healthcare, you kind of lose the opportunity. So there's that dilemma again. If we don't do this now, we're going to lose the chance, but if we do this now, it means that we're either overburdening or not everybody gets as much attention and care as they need, or somebody else has to go, one in one end and somebody out the other end. So lots of tensions that cause us to be thinking about what should I do here, and that's sort of the clue that you are in an ethical situation is you're thinking, what should I do? What's the right thing to do here? So kind of keep that question in mind as you move through your day and your week and think about when I have that sort of uncertainty or the thing that's kind of rolling around in my head that you can't shake on your way home, or the thing that wakes you up in the middle of the night, what should I do here? Or did I do the right thing? You're probably thinking about ethics. So I'm going to just kind of go through this, and we can come back to some of those examples if I'm not kind of catching the ones that are bothering you. One thing to know is that there are resources available, so different ways that you can get some support. The picture on the screen right now is just the front cover of our WRHA Ethics Decision Making Guide. And it is available on the public-facing WRHA webpage. If you've used another ethical decision-making framework or tool or guide, it's similar. This is something that we kind of took a number of different ones and sort of squished them together into something that we have adopted as a region. But pick a decision tool and use that, because it'll help you walk through systematically. Remember I said that ethics is a roadmap. This is sort of your atlas or your roadmap. This is going to walk you through systematically all of the things that it'll be helpful for you to think about as you're working through the situation, so that in the end you can feel like you've thought about everything, all of those factors that you needed to think about. So this is available publicly. The things that it'll walk you through are the things that are on the screen here, among other things. And it takes each of these things and sort of asks you some questions and gets you thinking about and talking about these different factors that will help to sort out what I find is when you've got a difficult situation or a difficult decision that you're trying to make, when you go through a discussion, most of these things will come up fairly naturally. A decision-making guide will just help make sure that you haven't missed any. And as you're talking through them, often the answer, the best answer, I won't say the right answer, but the best answer will kind of make itself known or will float to the top, so that by the end of the discussion, you can feel pretty confident that you know, maybe it's not great, but this is the best that we can do in this situation. So I'll kind of go through each of these separately, and feel free to kind of stop and ask questions or make comments as we go. The first one is the idea of values. So this is, remember I said right at the beginning that ethics is always about a disagreement about what's important. And what's important is our values, what's valuable or important to us. And those value sets that we have as individuals are made up of some they can be very complicated. It's a whole bunch of different things. You have personal values that come from things like your upbringing, your education, your life experience, your beliefs, your faith, your cultural traditions, all of those things that kind of make up who you are personally. We also have organizational values. So SCY has a set of values, WRHA has a set of stated values, and as employees of those organizations, we're expected to uphold those things and to keep them in mind as we're making decisions through the course of our work. A lot of times I find that organizational values are not terribly arguable. They're all kind of nice, almost motherhood and apple pie statements. Nobody's going to say, no, we don't need to treat people with dignity. Like, it's pretty hard to argue with some of these things. When it gets a bit challenging is when some of these organizational expectations or standards maybe conflict with your personal values. And so you can get some tension there, even within your own value sets. There are societal and community values as well. So you may be working with a faith community or a cultural community. You might be working with a geographic community. Sometimes the community is the group of people you have on your caseload, because you need to think about how your decisions with respect to one are going to affect your decisions with respect to the others, your ability to provide care to the rest of the group. So community is just any group of people that has the same sort of similar interests in a situation. So we need to think about the values or what's important to those communities. And we also have professional values. So OT, physio, anybody who works under a regulated health profession will have a set of values. And so your professional values will guide how you make decisions and will guide your sort of philosophical orientation in making decisions. And these can get really complicated, because you can see that your professional values, I'm a nurse, so you know, I may have a nursing value like duty to care, or not abandoning my patient, that conflicts with a personal value like participation in assisted death or abortion, or some of those sort of more controversial things. So if my personal belief is that these things are wrong, and my professional value is you provide care no matter what the person is asking for, that can conflict. And so you have to think about how your own personal values might be in tension with your professional values, and organize your work life that way. So it's important to think about these things ahead of time. And it's also important to recognize that no matter what we have as our bundle of values, which are very complicated, everybody around a decision-making table also has a set of values. And sometimes they overlap very nicely, and sometimes they just don't. They butt up against each other, and they're mutually exclusive, and they conflict. And so that's where the tough stuff happens. That's where those tensions and those conflicts happen, when you have a family or even a client who says, no, this is what I want, and a team, a healthcare team, or an individual on the team that says that is not the right thing to do. And so you can get to a point where you can't do both. You can't do it and not do it, and so you have a dilemma. So these seem kind of dire and hard to start with, but what we need to do is start by thinking about where we overlap. What do we have in common here? And most of the time, I would say all of the time, we all agree that we want what's best for the client. Where we might disagree is what that looks like and how that will play out in the situation. But at least we have a starting point, and once we can get to that point of commonality, we can start thinking about how where we differ and how we might resolve some of those differences. So the way we do that, we're going to think about things like make sure we identify what's important to the people that are involved, what's important to the client, to the family, to the members of the team, and think about, I suggested that you think about your own values. How do your values affect your reaction to this case? Is this one of those things where you've said in the past, you've thought about this a lot and you thought, I would never do that for my child? How is that affecting your interaction with a family who says, yes, we want this? You know, you might have said, I would never do a feeding tube. And you've got a fairly strong sense that that would be the wrong thing to do. And you've got a family who says, I don't care, do everything. I want a feeding tube. I want a ventilator. So how are your values affecting the questions that you ask, and your, how are they, you know, what are they doing to your participation in the discussion? So that's an important thing to think about. The provocative question there in the middle, whose values are important? Well, the right answer to that is that everybody's values are important, but sometimes we have a situation where we sort of have to prioritize, and often it's the client and the family that get their needs met before the staff. And so there's an expectation that even if I don't believe that this is the right thing to do, I kind of subordinate that, and we sort of preserve the right of the family to make their decisions. And that can be pretty hard for staff people, but it's one of those things that our personal value sets, our professional value sets sometimes require us to do. So we need to think about how we're balancing that. And ideally, if we can respect everybody's values and choices and what's important to them, that's great. But how do we, when we can't, how do we prioritize one without absolutely steamrolling others? And so how do we do the best we can to balance things? So those are tough situations, but when you start asking questions like this, it gets you to the heart of where do we agree, and then where are we starting to differ? Another important ethical lens is the idea of ethical principles. So this is stuff that you will have thought about, you'll have heard about before. Respecting choices are really important. It's a really critical consideration in all of healthcare. This is almost sort of the first thing that we do. This is part of the reason that we very often prioritize client or family values over others. So because we recognize the inherent worth of an individual, and so we respect their choices. This is where respect for choice and autonomy is where informed consent comes from. It's why we ask people for their consent before we do things to them. So that's a really important thing. It's not necessarily more important than any of the other things, but it's something that we tend to prioritize as a system and as a society. Doing good, the principle of beneficence, providing a benefit. This is where we think about what's in the best interests of the client and of the family. So what are we doing that will do the most good? And then the flip side of that is, how can we prevent harm, or how can we avoid harm? What are we doing here that might be harmful, and how can we minimize that harm if we do have to do something? The final one on this screen, the principle of fairness, or the principle of justice, talks to us about equality and equity, and I suspect that you think a lot about that in the work that you do, because we need to think about treating like situations alike, but also recognize the important differences between situations, and how do we make sure that we're treating people fairly and we're applying our rules consistently and that kind of thing. So ethical principles, when we're talking about those with respect to a particular situation, we're thinking about what do we know about what's important to people? What do we know about their perspective of autonomy? And you know, what do they want, and how can we respect that? What do you think will do the most good? How will we balance the goods and the harms in a situation? I always think about giving needles as a really interesting balance between good and harm. Vaccinations, for example, you know, the good is immunity, and in order to have immunity, you're sort of preventing or avoiding a communicable or a vaccine preventable disease. But in order to do that, you have to cause a little bit of harm. You might need to put somebody at a risk of a reaction. You might need to cause a little bit of discomfort when you give a needle, but it's all sort of in the way that we're balancing the good and evil. If you've got, I did most of my clinical nursing at Cancer Care Manitoba. So I thought a lot about how we cause people harm with chemotherapy. You know, putting needles in can be harmful, putting caustic chemicals in can be harmful, but it's in the name of sort of a greater good. And so with kids, we always talked about how, you know, you don't have a choice about whether or not to get your treatment, but you can have a choice about what arm you would like your needles in, that kind of thing. So how do we balance those things? And then what's fair, and how do we balance the obligations that we have to different individuals? And that kind of goes back to the comment about thinking about what's fair to the people on our caseload and what's fair to the people who are waiting for treatment. And we do sort of have a higher obligation to the people right in front of us, but we also got to recognize that there are limits to our human resources, our time resources. And so how do we give as much attention, as much preserve as much capacity for caring for everybody as we can when there's an infinite need and a finite amount ability to meet that need. How's that so far? Any thoughts? Any questions? Yes.
I think it's interesting to think about values and ethical rules at the same time. So I feel like something that's becoming more and more challenging as we have children that are more and more complex that we're looking after, getting into situations where there's distress at times on part of the care team, just in providing care, knowing how complex they are and worrying about quality of life, trying to balance parental values, your own values, and then thinking about all of the pillars. And it seems like a lot of the times you can't really find a solution that answers all of it, if that makes sense. You're often, or not often, but there's cases where you're providing care that you worry is maybe not the right thing or the best thing to do for the child, but it's, you know, trying to figure out what is your value versus parents and what is actually the right thing to do. So I feel like the situation is coming up more and more, and it's really hard to put them all together to figure out the right thing.
Yeah. Okay, just to recap, that was a comment about the tensions between your own values as a provider and how to balance your values against the values of the family and of the clients, and recognize that the more complex our care is, the more these things get multiplied. And I think my thought on that is that's sort of the nature of an ethical dilemma, and that's why it's why we have ethics in our health systems, is so that we can help you think through some of those really tough ones. These kinds of considerations will help, and I have a few more sort of lenses that might kind of add to the discussion, but I think what you're hitting on is the idea of our relationships, the relationships that we, and the reasons some of them are so complicated, and probably especially in pediatrics, is that and I'll talk quite a bit more about this in a few slides, but just the idea of how we create and then maintain the relationships we have with the clients, and how we sometimes do things that maybe wouldn't make ideal sense or aren't the perfect solution, but we do it because of the relationship that we have with people, or because of the relationship that the family, the parents have with the child. And so we might be doing things that we don't necessarily feel are the right thing to do in the big picture, but in a smaller picture, when you kind of focus in on it, it is the right thing to do for lots of reasons. So hold that thought, because I think we'll come back to it a little bit when we talk about some more of these lenses. But I think, you hit the nail on the head. This is the nature of ethics, right? This is why we have things like decision-making guides, because it's exactly what you struggle with all the time with most of the decisions that we make. Another important lens, and each of these lenses comes from moral philosophy, which is really not very interesting, but when you think about how it applies in real life, it gets much more interesting. So we do have a certain set of obligations as healthcare providers. So we have legal obligations. I talked about Child and Family Services earlier. There are some times when we have a legal obligation to report something. And so that can be the hard stop. That can be the parameter. I'm sorry that I have to do this, but you know, the situation has met these criteria, and so I have to call it in. We also have professional obligations, so things like codes of ethics and standards of practice. If we are practicing as a regulated health professional, we answer to those standards and codes of ethics with our license. And so to break those rules is a pretty big decision, and it would have to be very well defended if you could defend it at all. We also have corporate obligations. That's just sort of a fancy word for policy. We have lots of policies and rule sets that we've organized in order to kind of constrain our choices and constrain our behavior and keep it within a certain set of ethical parameters and sometimes legal parameters as well. I don't want to overlap those too much, but they're often talked about in the same conversation. And then community obligations, and often that's how we recognize the values of a particular community or what's important to that group of people. And so these are duties, these are rules that we need to follow. What's challenging is when there's some discretion in how we apply the rules, and we have to make a choice about when or if to apply the rule. But there's still a sort of a sense of obligation that we need to do these things because they're the right thing to do. So when we're thinking about obligations, we're thinking about what laws might apply here. So often in PEDS, it's going to be child and family services. It might be protection of persons in care, that kind of thing. So there are those kinds of a Mental Health Act, those kinds of things that are important to think about. How do our professional codes of ethics and standards of practice guide us? So sometimes when you've got a tough situation, the best source of information is your college, calling your college and talking to a professional practice consultant or looking at your code of ethics. What are our policies, and what guidance does our organization, our employer, give us in a case like this? Sometimes these can cause more questions and concerns and conflict than they resolve, but sometimes they can be helpful, and sometimes if they do cause more discomfort, it's a sign that we need to kind of relook at the policy. Maybe it doesn't apply or it's not as useful. And then how can we make these decisions and still feel like we have our own integrity, be true to ourselves, because we have obligations to ourselves as professionals, as human beings, to do what we think is the right thing to do, but also balance that against our obligations to the clients and families that we look after. So our obligations are important, and sometimes they can be the hard stop, but sometimes they can also cause more discomfort than they resolve. So when we're talking through something, we're talking about values, what's important in the situation. We're talking about those ethical principles. We're going to talk about our obligations and what we have to do in a situation. What are our duties? We also need to think about the outcomes, the consequences. What could happen as a result of this decision that we're making or these options that we're considering? So we're going to think about things like, what are the benefits? What are the risks? What are the possible harms? How serious would those harms be? How likely would they be? We need to think about the risks and benefits for the individual, so for the client, but also for the client's family and their extended network, and for the healthcare provider themselves and for the team. What might happen if we do these things? We need to think about these things long-term and short-term as well. So if the discussion is about a feeding tube, for example, it might resolve a problem right now, but it might cause more problems down the road. And so we kind of have to balance those. And these ones are tough because they expect you to look into the future a little bit and think ahead and make some guesses about what could happen. And that can be a little bit uncomfortable when you aren't really sure what the consequences might be, or when you are sure, but maybe there's some disagreement with the family about how best to resolve that, or what priority needs to be put on the likelihood of the consequences and the outcomes in the end. So this, I think about this as the ripple effect. Like, what would happen if we make this decision versus this decision? And sometimes it's just sort of a bit of almost a pro-con list that you have to go through. So I've kind of talked about these questions. What's the best thing that could happen? What's the worst? How likely, how serious would it be? So we're going to give a lot more consideration to a life and death decision than something that's maybe a little bit more trivial or less heavy, less consequential. What will the effect be right now versus 6 months, 2 years, 5 years from now? and what would be the ripple effect on the stakeholders. So not just the individual client, but their family, their extended family, their community, and then the healthcare team, and ultimately sort of wider society, the people on the wait list and that kind of thing, recognizing that the major priority is the person in front of us, and recognizing that the decisions we make there will also affect the people further out on the periphery. So these are questions that when you're thinking about that, you put more or less weight on, depending on how close they are to the situation, but they will help you recognize these are the things that we need to think about. And this is relationships. So this comes back to the comment that we had just a few minutes ago. But the idea that when we are engaging with people, sometimes the relationship is the major decider of what's the right thing to do. So we might say, yes, we will try this remedy that you found from Dr. Google because you know that it will help the family feel like they have done everything. Even if you're pretty confident that scientifically it's not going to do much good, it might not do any harm, and so we will do something that we wouldn't necessarily consider to be standard of practice because we know that it will help give some comfort or some closure to a family. That might be something that we'd think about. But how do we do this while we treat people with dignity, while we treat people with respect? And that dignity and respect sometimes is why we do things that might be in tension with or slightly controversial, in tension with or in conflict with our standards of practice. Because we respect the family, we recognize the role that they have in the care of this child. And so, you know, we're treating the child with dignity and respect, but also the family as an extension of the patient, of the client. We have to recognize the context as well that these decisions are being made in. The circumstances of a decision and understanding those circumstances can make a huge difference to how we understand and how we feel about what a family is asking us to do in terms of intervention, especially if we don't necessarily agree with it. You know, how we relate to or interact with a family who has already lost 3 children to a particular condition that might be different for the 4th child. We might be willing to try something controversial or unproven because we know that it will help them with their journey and their process. So recognizing the context that's happening, all the decisions that are being made within a web of relationships. So a family will think about things differently. Happens in palliative care all the time. You know, we think about, why would you want this 4th kind of chemo? Everybody knows this is not going to help. When you ask the client, the patient, they'll say, well, I really want to make it to my son's graduation, or I really want to get to this wedding, or grandpa's coming from overseas. We'd like him to be able to see him one more time. And so when you understand that context, a lot of times things are much more explainable. I think it's also important to remember that power is a huge factor in healthcare. As healthcare providers, we have a ton of power. We literally have the power to save somebody sometimes or not. And so we have to recognize that people are clients, families, especially families with kids, are feeling a real loss of control and loss of power. And so sometimes we make our decisions based on how to hand some of that power back, how to re-empower the people that are at the center of the care. And that can be hard to do because we don't always recognize or remember that we have that power. But a lot of times the sort of the inexplicable things that come to us as healthcare providers are because people are just desperate for a little bit more control over their life and their care and the interventions that they're enduring. And so we need to kind of recognize that and think about that. When we're thinking about relationships, we're thinking about, how do we demonstrate respect? We might have an internal eye roll when they come in with their sheaf of papers from Dr. Google, but we're not going to show that because that's not respectful. We're going to listen, and maybe there will be something in there that we can work with. How do we hand back the power that people have lost through the course of their health condition? And how do we continue to focus on providing person-centered care and making sure that people have as many choices as is possible for their situation? The other really important thing is recognizing what is the context, what is the circumstance or the situation that people are coming from, and that can go a long way towards explaining some of the decisions that they're making that make everybody else kind of go, why would you do that? But when we recognize that, it makes it a lot easier to demonstrate respect, to demonstrate empathy, to be empathetic, in fact, and understand that the choices that people are making will reflect the choices that we're making and our respect for them. So thinking about how those relationships are working in this situation is going to make a difference to what's the right thing to do and the wrong thing to do. I didn't do a recap, but just to recap those sort of 5 important factors, we're going to think when you have a tough decision to make, you're going to think about what is important to the people involved. You'll think about those principles, those moral principles like respecting autonomy, doing good, preventing harm, being fair, treating people fairly. We're going to think about the obligations we have. So what are the duties, the laws, the policies, the standards of practice that we're expected to uphold? We're going to think about the ripple effect, the consequences. So what could happen as a result of this? And then we'll think about the relationships and how those relationships are affecting the decisions that are being made, the interventions that are being requested, the interventions that are being offered, and how we get context and power and balance things that way. All of this is to say that it's not necessarily going to resolve a conflict, but how can we prevent those conflicts in the first place? Because we're always going to have differences of opinion, differences of perspective on what's important in a situation. So how do we make it so that we don't get into those situations where everybody hates everybody, nobody's talking to anybody else, and you need a mediator to come in and fix things? So how do we prevent them? We need to think about things like therapeutic boundaries. So where are your lines between how close you can get to a client and how to maintain a professional boundary or professional separation. And we do that by recognizing that we're not their friends, even if we really like them, that we have, there is sort of that barrier there that we need to maintain, but communicating openly, being honest, being transparent, helping people understand where we can help and where we can't help, what's an option and what's really not an option. Not offering things that really aren't a therapeutic option. We have a discussion, I often have a discussion about CPR, especially at end of life and especially in different long-term care settings. You know, we almost present CPR as an option for some people when we know it's not going to work for somebody with end-stage cancer who's 95. There are some places CPR will work and some places it won't. And so communicating openly and being honest and transparent about when it will work and when it won't doesn't set us up for please tell us if you want us to save your loved one. It sets us up for, I'm sorry, this isn't an option for us, but here's what we can do. So open communication and discussing things early on in a trajectory. So as a professional, you probably can see where a situation is going and what's likely in a situation. So making sure that you've had those conversations sort of upstream so that people are prepared for it, because often they feel blindsided when we can see what's coming and they don't necessarily. And then sort of figure out what might be a conflict coming down the road and do your best to address it ahead of time. Another important question to ask, to think about, is the idea of what do I need to know about you as a person in order to give you the best possible care? And that's a question that's come out of palliative care, but I think it's really applicable in any area that we work in healthcare and in even not in healthcare, even just you know, colleague to colleague. When you ask that question or some variation on that question, you get lots of really interesting information. So you get to find out, we're hoping that he makes it to graduation. You know, you're getting things like, we have 4 other kids and I don't know how we're going to manage this. And so that gives you all kinds of insight into the questions and the choices and the behaviors of the people in the situation. And it can really help with that relationship building and with that empathy piece. So that's a good one to think about. When you are identifying conflicts, when you are thinking about what you're going to do in a tough situation, find someone to talk about. Figure out who your resources are, whether that's calling my office, talking to your supervisor, finding a colleague that you trust, finding somebody who's taken ethics workshops or who's interested in this stuff and can help you find a decision-making guide and work through it together. But figure out who your resources are and don't try and do it alone, because it can feel very isolating and these things are pretty tough and emotional sometimes. Call us. Make sure you document the decisions that you're making so that when and if you need to discuss it after the fact, or somebody comes to you and says, okay, you know, I can see that this was done. Can you tell us how it happened or why? You've got that documentation down. And then don't forget to do some evaluation after something has happened. So debrief. How did we do? Did we have the right resources? Did we think about the right things? Was it the right decision in the end? What was the process like? What can we do differently next time? Make sure that you have a safe space. So figure out who's your person, who's your contact, who's your resource, who will you go to? And sometimes it'll be different from situation to situation. Sometimes it's okay to go to your supervisor or go to a colleague. Sometimes you need outside input, outside help. If you're really struggling with moral distress and there's not a lot of remedies apparent, sometimes coming to my office, going to EAP can be helpful, but just find out what you have and what you need. Some areas have developed ethics committees or ethics sort of lunch and learn communities of practice within their area that will help them kind of connect and work through things sort of as a sounding board or an objective outside opinion on things. So figure out what you need, and if you need some help setting things up, I can also help with that. And that's kind of all I had to say sort of as prepared remarks. I know that I'm probably pretty close to the end of my time, but I'll leave this contact information up on the board in case anybody wants to get in touch with me afterwards. But does anybody have comments or questions or thoughts about any of this stuff or how it applies to your work or anything you want to talk about more?
I really like that last question that you put up there. We often in our visits will ask parents what their goals are so that we can figure out where they want us to go. But I think that's a much better way of phrasing it because you get that personal and value side. And we often project our own goals and values onto our families. And so I think that's just like a really nice way to get the information that we need so that we're able to move the point in the right direction.
So the comment was about that question. In palliative care, they call it the dignity question. What do I need to know about you in order to give you the best possible care? And it's sort of analogous to the asking a parent or a family, what are your goals in this situation? And it's almost a variation on the theme, but it kind of gets at different kinds of things than just goals, because goals could be something pretty like, I want them to survive. I want them to go to high school. I want them to graduate, that kind of thing. But it could also be, it could also get at sort of the context that they're coming from. You know, what do I need to know about you? Well, you know, we've been through this 3 times before, and I know that it's probably not going to be the best outcome, but what's important is X. And so it just kind of gives you a different way of asking those questions. And you don't even have to ask it in those specific words. You can find a variation on that. But there's been quite a lot of interesting research. Harvey Chochinov is the researcher. He's a palliative care physician here in Winnipeg, and he's become quite well respected for this work on dignity. And the context of his work is mostly palliative care, but I really do think that it applies to just about everything. Mm-hmm. Yes.
When does a legal document, when can it be overridden by, say, a doctor? We have a family situation where there's a 90-year-old in the hospital who has a legal document the opposite of do not resuscitate. He wants everything done. And we discussed it with the doctor because he's sort of not that well. And the doctor said, no, he refuses, even that the document's there because he's 90. So what do you do in that case?
Okay, so the question is what happens when you have a legal document like an advanced care plan or something that says something that is quite contradictory to the sort of what the standard of practice would be. So that maybe the opposite of a do not resuscitate. So an ACPR is the do everything kind of code status. And when you've got somebody who's 90 or 95 or has end stage organ failure, resuscitation, you know, is not going to be effective. And so it's a really morally distressing situation for the healthcare team that's expected to intervene when somebody's heart stops because of that. Most of the time, conflicts like that come out of a lack of understanding and communication with the healthcare team that hasn't been very effective for one reason or another. Maybe it's a personality conflict. Maybe they, the first physician or the first person who sat down to talk about this with that family just kind of rubbed them the wrong way or approached it in a way that wasn't very effective. So very often, if you can have a conversation, and actually one thing that I would encourage you to do is a resource that I'd encourage you to look at is actually on the Canadian Virtual Hospice website, and it's Mike Harlow's, who wrote a column. It's like a 2-page column called Sit Down, Lean In. And it's about having a really hard conversation with people about what's going to work and what's not. And so it kind of goes back to the comments I was making earlier about not offering CPR when it's really not something that's going to be effective, that you know it's not going to be effective. And he's got all kinds of creative and sensitive and empathetic ways of saying, we know it's not going to work in this case, so this is not something I'm going to do, but here's what I can do. Here's how I can make him comfortable. So it's about setting realistic expectations and things, but it's an art to communicate those kinds of things really sensitively. And at some point, if somebody says, I understand, I'm a competent adult who can make my own decisions and I still want this thing, it's pretty tough to say no. So you do it recognizing that it might not work. The other thing about end of life kinds of decisions like that is for physicians, they have a provision in their bylaws, the physician practice bylaws, that says they can override an ACP status in certain circumstances. And there's quite a lengthy process that involves lots of communication and probably some lawyers and some judges where they can make a decision to not offer certain interventions even when the client wants them. It's a tough thing, and it gets very adversarial. And if you can prevent that by finding ways to communicate effectively, getting a mediator involved, getting a client relations person or an ethicist involved to help kind of facilitate a resolution, help even just, I think it happens often where families say, do everything we need you to do, everything we want them to live, and the healthcare team knows that it's not going to be effective. Finding a really sensitive way to communicate that it's not going to be effective and that here are the things we can't do, and then support them through the grieving process when the inevitable happens. So that is a really tough situation. Mm-hmm. So I think we're probably at time. I'm happy to stick around and keep chatting if people have other questions, or you can always call or email me if you've got something that you don't want to ask in front of a room full of people, but that's okay. But thank you very much for having me. It's always interesting to get to explore other areas of healthcare and the kinds of tough situations that you run into. I like how this stuff makes my brain work. So thanks for the opportunity, and I may see you tomorrow. I'm back again tomorrow to do something similar for another group. So thank you.
Thank you very much, Jennifer. So I just have a little announcement from the Children's Therapy Initiative Network. So if you didn't get enough ethics today, or tomorrow perhaps, you can join the CTI network on Friday, May 31st. They're hosting a workshop on ethical issues in pediatric clinical practice. And it actually won't be by Jennifer. It will be with Katarina Lee, who's the clinical ethicist at St. Boniface Hospital. So if you want a slightly different ethical perspective and more ethics, you could contact Michelle Lark or myself, and then I can give you more information. And then if you would like to join us next month for Breakfast at Sky, we'll be hearing about shared health services in Manitoba. So we'll be learning about all the changes that are happening across the province. Great. Thank you very much, Jennifer.
Yeah.